We're here at the Los Olas Med Spa in Fort Lauderdale, Florida. I'm here with the Magic Surgeon. Welcome. So you trained at one of the top medical institutions in the world, the Mayo Clinic. What was that experience like?
Yeah, it's an amazing experience. You know, the Mayo Clinic is located in Rochester, Minnesota. They have 3 branches. Actually, there's another one in Scottsdale. There's another one in Jacksonville here in Florida. But the original one is the one in Rochester, Minnesota, and it's an amazing health institution in the middle of nowhere because this is not Rochester, New York. It's like Rochester, Minnesota. And when you go there, you know, imagine that they have 2 main hospitals, and each hospital has 60 operating rooms.
Wow.
So it's an amazing experience, and they are fully dedicated to education, and they have pretty much endless resources. So to be able to participate from an education like that, where you can have cadaver labs every week, things that are not very common, you know, in other places, it's amazing. And then the faculty, the quality of the visiting professors, it's actually a really, really good experience. So I got lucky, and it's a lot of effort that takes you to get into a competitive program like that. So
how long were you there for?
I was there for 2 years.
Okay.
Yeah, 2 years, which is my plastic surgery training is what I did there. But I did train in general surgery before, you know, so I did 6 years of general surgery and then 2 years of plastic surgery. Although I've been doing a lot of plastic surgery during my general surgery training too.
Wow.
So I've been doing plastic surgery for over 20 years now.
Wow.
Yeah.
Can you describe some of the challenges that you've had?
Well, you know, surgical training is actually pretty rough. I compare it to a pretty rough military program, you know. It is long hours, sometimes 48 hours, 72 hours, and 0 sleep. Taking care of, you know, I trained in a level 1 trauma center too when I did my general surgery training. So that was pretty interesting. And after you spend 6 years in a level 1 trauma, you are not scared about anything. You know, and then I went and did obviously the plastic surgery training, and during that process I got involved with education. I did a lot of research. You know, I published research papers. I wrote books too. So I think it's good. And I am currently an associate professor of surgery from Texas Tech University.
Wow.
So I continue to hold that academic appointment, and I love education. So I interact with students and residents all the time.
What's one of the rewarding things of being a professor?
You know, it's just, I think you had to pass it on, you know, like I think everything that we receive from our mentors and professors, it's time for us to give it back, and teaching the next generation of surgeons is pretty amazing. And I love technology, so I love to educate people in the use of AI and things like that, and I think that is, they receive that very well, and I have residents contact me all the time to participate from surgeries and just learn from all the techniques that we use.
How do you prepare a patient mentally and physically for a transformation?
That is challenging, you know. We try to put out there as much information as possible and talk to the patient to leave no questions unanswered, you know. So the more you educate the patient before, the better the patient is gonna take the whole process. So we have a YouTube channel with, you know, about between the 2 YouTube channels, we have almost 200 videos, and that is mostly for education. But we do contact the patients frequently to tell them, give them the links, or talk about them, you know, which really have no questions going into surgery. And that is extremely good to set up the expectations right and to educate the patient through the process. So
we talked about AI and stuff like that. What role does technology play in your practice?
We're very focused on technology. I think obviously technology allows you to advance in any field, and the surgical field is not a different field. So what we, for example, things that we employ technology, things that are not done everywhere, are we can monitor your hemoglobin level. We can monitor a lot of you know, aspects on the surgery that are done through different technologies that are not commonly used. So we can see, for example, how asleep you are. You know, what's the depth of your sedation or anesthesia, which is important. You don't want to be too sedated or too shallow, right? You don't want to be awake, or you don't want to be too far deep in sleep because it's going to take you longer to recover. So we use things like a Segway or the SegLine that allows you monitors in your forehead. It's an EEG, electroencephalogram. We also use a non-invasive hemoglobin, monitor, so we know what your blood levels are, during surgery, and that is technology, and that is things that are not used everywhere. Those things are actually great. And then obviously for the pre-op process and post-op process with simulations and things like that, they are very, very important, because communication is everything. Patients will know how they're going to look, or we can have that conversation to set up the right expectations.
So with the AI software you're able to show the clients how they're going to look after the surgery.
Yeah.
You're able to show 3D models of it.
Yeah.
How important is that?
I mean, that is everything is set up, the communication right and the expectations right. So the patients are going to be only happy if they know what they're getting or what they're going to get. If they have a vision but you don't deliver into that vision, they're going to be unhappy. So we don't want that. And being able to, through technology, show them exactly how they're going to look, even in 3D, that is pretty amazing.
Yeah, that is amazing.
Yeah.
So you're board certified. What exactly does that mean, and how is that significant to your patients?
Yes, so the board certification in the field that you're practicing is extremely important, because it allows you to say that you have been going through the examination necessary to make sure that you are safe to practice to the public. So it is a process. So we had to do a written exam and an oral exam after the first year of practice, where they actually evaluate how have you been practicing during that year. They evaluate not only cases that you don't know, but the cases that you have done. And that will show that you meet the requirements to practice safely to the public. And that is exactly what board certification is, and that's why it's so important.
How has the field of cosmetic surgery evolved in the last 5 to 10 years?
I think it's a constant evolution. Plastic surgery and cosmetic surgery, always there are new technologies, new techniques, things that we didn't have before. For example, radio frequency, technologies pretty much that are coming into play are allowing you to get better results. And I think that evolution is great to see. Fat grafting, we were talking about fat grafting. It wasn't that common 20 years ago. And now fat grafting, for BBLs and other areas allows you to do magic things.
What is that exactly?
So it is the transfer of fat for the BBLs.
Okay.
So what you do is you suction fat from one area and then you transfer it to another area. That's a commonly known BBL.
So that's become popular in the last 5 years?
I would say maybe like 10 years.
10 years?
Yeah, 10 years. And that had been a little bit of a revolution. That used to be the most common procedure, used to be liposuction or breast augmentation. And you can see the BBL is becoming actually the most common procedure performed. And that is pretty much the evolution of fat grafting, both with techniques for harvesting the fat or removing the fat to injecting the fat. And I think it's pretty fascinating, the evolution that happens in plastic surgery.
What do you see the future of plastic surgery as far as BBLs?
Yeah, so what I think is going to happen in the near future is that you're going to have more like a visual representation of how you're going to look later. And it's going to be pretty accurate of what you can expect
because of AI and stuff like that.
That's right. Yeah. That's right. And I think that you're gonna step in front of a mirror, and the mirror is gonna tell you how you're gonna look.
Wow.
With that particular surgeon, and I think that's pretty remarkable.
That's very remarkable. So tell us about the Top Aesthetics team and what makes you guys so different.
At Top Aesthetics, we had set up. I always say that we are like Tesla. We are not the most expensive, neither the cheapest, but we are the most efficient and the safest. So it is something that we have. The way that we created that is doing a lot of putting a lot of resources to the pre-op, the op, and the post-op, and controlling the whole environment is what makes us different. A lot of places, they might be good in pre-op, make sure that you're a good candidate for surgery. Then they might be good at surgery, but then they send you home. And they don't complete the care, and that is very common, especially in the United States. Nobody really has the comprehensive post-operative care.
So you would say most surgeons do the surgery and it's kind of like, okay, that's it.
Yeah, and then go home, and your husband will take care of you. And it's not like
the
that.
husband doesn't know what to do in case any complications come about.
That's right, and nobody, unless you are in the business of post-operative care, is equipped with the right tools to take care of patients. And you would think that the BBL is a simple procedure. It's actually, the recovery for BBL is pretty demanding, and I think it's...
How long is the recovery?
I would say it's a good 2 to 6 weeks,
Okay.
In the first 2 weeks, you're gonna really not be able to do much. And then at 6 weeks, you're gonna return to the normal life. So I think it's important during those first, week or 2 weeks that you're carefully monitored, and closely. And that's why we created the post-operative.
I know a lot of girls, when they get the BBLs, they can't sit down for a while.
Right.
They got the BBL pillows and stuff like that.
Very important. I mean, post-operative care is 50% of the equation, so that's why it makes us different. At Top Aesthetics, we really put a lot of emphasis on that. We are a training center and we are extremely safe, and that is very important. So for those of you that are looking into this, and people can see our reviews, that says it all. That when you get the reviews that we get, is that people saying what we are, and I think that is great, and that's mainly what makes us different.
Where do you see your team going in the next 5 years?
I do believe that we're going to continue this evolution. Having trained at the Mayo Clinic and having done things a little bit different allows us to push this into this direction. And I think more people is going to try to emulate this and to try to do it, but it's very difficult. Taking care of the whole thing it takes a lot of effort, and we rely on technology to do that. So when the patient does a booking, automatically triggers the booking for our surgery. It triggers the booking at the hotel. It triggers the booking for the care. It triggers the booking for the massages, and all of these things happens in the background. We don't have to be calling 20 people to arrange everything. So things that we have built over the time of the years actually are paying off, and people, when they come here, it seems that everything runs smoothly, and that's how I think it's going to happen to continue to evolve into a better system. Who knows what's coming next, but it's going to be good.
So besides BBLs, what other services does your clinic and med spa provide?
Yeah, so we do pretty much every service that you can do in plastics and cosmetic surgery. So BBLs, Brazilian butt lift, is fat transfer. Obviously, we do that along with liposuction, but we also do things like a mommy makeover, which is a tummy tuck and breast. For example, here's a breast implant. We use these breast implants to actually enhance the volume of your breast. We can do it along with the breast lift or just the breast augmentation. I think the combination of procedures allows for the enhancement to be amazing. I think increasing the curvatures not only starts in your hips and your booty, but you can also do the breast.
Yeah.
And you can thin down even the waistline by doing tummy tucks or just the liposuction portion. And then at the med spa, we actually offer all the non-invasive services, and we offer Botox, fillers, lasers, hydrofacials, all the way to like stem cells injections, so pretty much everything else that you can have.
What is stem cell injections?
So stem cells injections, I think is important to discuss it, because usually if you're going to have liposuction, we can extract the portion of the fat,
okay,
send it to a specialized lab that we work with, and then they will extract your stem cells, which are the cells that make your body, and then they freeze them for you and they keep them there. And in the future, when you need them for, let's say, repair a knee or a joint, or even get an IV because you're having an immune problem, then you can get it. They
Wow.
can regrow them, send it to you.
How long has that technology been out?
That technology has been out for, I would say, maybe like about 20 years, but
Okay.
it has only been popularized recently because the technology allows you to make it available for all, and be not extremely expensive. So right now you can do that, and if you're considering liposuction, we can teach you a lot more about that. But you could freeze your cells and have them there for the rest of your life when you need it.
That's amazing.
Yeah, it is things. So this is amazing technology. This is great.
Amazing.
So
that's a wrap, y'all. Top Aesthetics, the Magic Surgeon. It's been a pleasure.
Thank you so much.
Yes, sir.
Thank you. Looking forward to it.